Good day, I'm Stephen McHugh, and this is your JIS News for Monday, October 12. Government will be scaling up public investment with $6 billion set aside in the second supplementary estimates for the 2020-2021 financial year. Finance Minister Dr. Nigel Clark says the objective is to revive economic activity and maintain jobs while signaling to the private sector government's confidence in the future. Dr. Clark says that of the $6 billion, $4.6 billion will go towards the South Coast Highway Improvement Project.
As we look to scale public investments at this time, the quality of public investments matter. And we believe that the South Coast Highway Improvement Project meets the definition of the kind of public investment that catalyzes economic activity and jobs, which is precisely what we need at this time.
The second supplementary estimates proposes overall additional expenditure of $15.7 billion to generate a total expenditure budget of $853.7 billion. The estimates also addresses the adjustment of newly created ministries following the recent general election. While giving an update on public spending, the finance minister told Parliament that the COVID-19 pandemic had reduced the revenues available to the government, while also increasing expenditure. He outlined that total COVID-19 expenditure to date was $36.8 billion.
When you add increase in interest costs in the second supplementary estimates vis-a-vis the budget, and it's really the first supplementary vis-a-vis the budget. The total COVID-19 GOG expenditure impact to date is $43.8 billion. Approximately, we have had to find approximately $44 billion to meet the cash expenditure of the COVID-19 pandemic.
An additional ward to house 24 beds for COVID-19 patients is now operational at the Cornwall Regional Hospital in St. James. Medical Officer of Health for St. James, Dr. Marcia Johnson-Campbell, made the announcement at Thursday's monthly meeting of the St. James Municipal Corporation. The new ward was opened last week and complements the recently constructed isolation unit, which is a 4-bed facility at the hospital. Dr. Johnson-Campbell says these measures are in an effort to deal with the recent surge in cases across the parish.
Unfortunately, 12 persons have died, but 398 have recovered. So we have 135 persons resident in St. James who are considered active, 20 of whom are admitted in facilities, whether the Cornwall Regional Hospital or our quarantine facilities, and 115 of them are currently in home isolation.
Up to October 11, there were 653 confirmed COVID-19 cases in St. James. The parish has the third highest number of infections, surpassed only by Kingston and St. Andrew and St. Catherine. Dr. Johnson-Campbell pointed out that COVID-19 containment measures in the parish continue, such as identifying persons who are symptomatic, contact tracing, and sample testing. Meanwhile, the public health sector is to be bolstered with an additional 127 nurses and 20 midwives. These will add to the 120 doctors who joined the health team recently. Health and Wellness Minister Dr. Christopher Tufton says the new nurses and midwives will be drawn from a recent batch of graduates certified by the Nursing Council of Jamaica.
These are persons who have graduated through the system, and I want to just say we are ready to take them on because we need more people to support the work.
He says government will also recruit additional nursing staff to fill any identified gaps through existing bilateral relations with Cuba.
When the COVID response started, we brought in some 150 or thereabouts, primarily nurses and specialist nurses. We have taken a decision to go back for more, maybe twice that number, but ensuring first that we use all the locals that have graduated and then complement with our Cuban friends and professionals.
Dr. Tufton says 1,200 patient care assistants are also being employed to assist nurses in hospitals. At the same time, recruitment will continue to increase the number of community health aides from just over 700 to 1,400. In the meantime, the Ministry of Health and Wellness has officially launched its COVID-19 Healthcare Worker Welfare Program. $75.8 million has initially been budgeted to support the program for a 12-month period. It will be bolstered by additional support through public-private partnership agreements. Portfolio Minister Dr. Christopher Tufton signed 2 such partnership agreements with Grace Kennedy Limited and Chukka Caribbean at the Jamaica Pegasus Hotel recently. Dr. Tufton says the welfare program will benefit the healthcare workers and their support systems, including family members.
The objectives are to increase staff morale, reduce the effects of burnout, build staff capacity within facilities, and boost the overall effectiveness and efficiency of service delivery.
The program will provide benefits under 5 components, namely human resource management, psychosocial support, rest and relaxation, COVID support, and wellness. And finally, the Ministry of Education, Youth and Information will soon launch its One Laptop or Tablet per Child initiative. The program is being launched in partnership with the Private Sector Organization of Jamaica, PSOJ, and aims to equip students with the tools to access online education.
We're seeing corporate Jamaica rally to the call already. These include the Musson Group, who on its own initiative has put in place a program to help their employees buy a laptop or tablet for their children.
The Education Minister was speaking in Parliament last week. She revealed that companies such as the Sandals Group, Manpower Maintenance Services, Premix, Digicel, and New Fortress Energy were already on board with the initiative. Electronic devices such as tablets and laptops have now become an important accessory for students across Jamaica as school resumed on October 5 with online classes. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.